Look, fellas, if you're over 40 and things don't work the way they used to, there's a good chance it's not stress, not age, and not just how it is now. The scary part is this. Most men are quietly making it worse every single week, without realizing it. I see guys who still have the desire, still have the drive, but when it matters most, their body doesn't fully respond. And instead of fixing the real problem, they double down on habits that slowly shut things down even more. What bothers me is how common this is. Smart, successful men blaming themselves, feeling embarrassed, wondering if they're broken. Here's the deal. There's a physical reason this starts happening, and there's a very specific way to reverse it. But almost nobody talks about it the right way. Let me introduce myself, if we haven't met yet. I'm Dr. Rosalia Viterbo. I'm a men's health specialist, and for years I've worked almost exclusively with men over 40 who are dealing with low energy, stubborn belly fat, hormone changes, and very often problems in the bedroom they never thought they'd be facing. And here's what I want you to know right away. The men I work with are not weak, they're not lazy, and they're not broken. They're busy, high-functioning guys who did everything they were told was healthy, yet their sexual performance started slipping anyway. My job is to help you understand what's actually happening inside your body as you age, and more importantly, what you can do about it in a practical, realistic way that fits your real life. Here's exactly what we're going to cover today. I'm going to walk you through 3 specific exercises that have a direct, measurable impact on erection quality, stamina, and overall sexual function, especially for men in their 40s, 50s, and beyond. I'll explain why these exercises work on a physiological level, how they improve blood flow and nerve signaling, and why most men completely overlook them while wasting time on things that don't actually move the needle. We're also going to talk about common mistakes I see guys make when they try to fix erectile issues on their own, and how those mistakes quietly sabotage their progress. And make sure you stay with me until the end, because the last exercise is one even many doctors don't explain properly. But it can be a game changer when it comes to confidence and performance. Before we jump into the exercises, you need to understand why this topic matters so much, because erections don't fail overnight. They fade slowly, quietly, and in ways most men don't recognize until the frustration sets in. Here's the deal. An erection is not just about arousal or testosterone. It's a coordinated event between your blood vessels, nerves, muscles, hormones, and brain. Think of it like a high-performance hydraulic system. You need strong blood flow coming in, healthy vessels that can expand, responsive nerves that send clear signals, and muscles that can trap that blood where it belongs. If any part of that system weakens, the whole thing underperforms. As men age, a few predictable changes start happening. Blood vessels lose elasticity. Nitric oxide production drops, which is critical for blood flow. Testosterone slowly declines, but more importantly, muscle mass and nerve responsiveness decline too, especially in the pelvic region. On top of that, stress hormones like cortisol stay chronically elevated, which directly interfere with sexual function. Now here's what men usually get wrong. Most guys assume erectile issues mean low testosterone, or I need a pill. So they chase supplements, meds, or quick fixes without ever addressing the physical mechanics. That's like trying to fix a weak water pressure problem by changing the light bulbs. Wrong system. Another issue is modern lifestyle. Sitting all day, driving everywhere, working long hours, not breathing deeply, not moving the hips. This absolutely crushes pelvic circulation. The muscles that support erections literally weaken from lack of use. And nobody tells men this. You don't feel pain. There's no warning light. It just slowly shows up as softer erections, delayed response, or losing firmness halfway through. And because men don't talk about this openly, they often internalize it. They think, maybe this is just how it is now. That belief is dangerous because it stops you from taking action when in reality, this is one of the most fixable issues I see in my practice when addressed correctly. The good news is this. Your body is incredibly responsive to the right kind of stimulus. When you train the correct muscles, restore circulation, and reactivate the nerve pathways involved in erections, you can see real improvement, not in some abstract health sense, but in real-world performance, confidence, and reliability. First, pelvic floor activation, not the way you've been told. Let's start with the foundation, because this is where most men get confused. You've probably heard of Kegels, and you've probably either ignored them or tried them once and thought, this feels useless. And honestly, I don't blame you. Here's what's actually happening. The pelvic floor muscles are responsible for trapping blood inside the penis during an erection. They act like a valve. When they're strong and responsive, blood flows in and stays in. When they're weak or poorly coordinated, blood leaks out and erections fade. Now, what most men think is that squeezing harder or doing endless reps is the answer. That's wrong. The issue for men over 40 is not just strength, it's control and timing. These muscles often become tight, unresponsive, or completely disconnected due to years of sitting, stress, and shallow breathing. What you should be doing instead is slow, intentional pelvic floor contractions combined with full relaxation. Think of it like learning to turn a dimmer switch, not slamming an on-off button. Contract for a few seconds, fully relax, and focus on feeling that release. That relaxation phase is just as important as the contraction. I tell my patients this all the time. Erections don't come from tension, they come from coordination. When you restore that coordination, firmness improves naturally. Second, deep squats for pelvic blood flow and hormonal signaling. The second exercise surprises a lot of men because it looks too simple. Deep squats done correctly are one of the most powerful tools for sexual function. Here's why. Deep squats open up the hips, activate the glutes, and dramatically increase blood flow to the pelvic region. They also stimulate large muscle groups, which sends a signal to your body to increase testosterone responsiveness and insulin sensitivity, both critical for sexual performance. As men age, hip mobility decreases. Tight hips restrict circulation and compress nerves that are essential for erection quality. That's why guys who sit all day often notice numbness, stiffness, or reduced sensation over time. What you should focus on is depth and control, not weight. Go as deep as your body allows while keeping your heels down and chest upright. Pause at the bottom, breathe deeply, and let the pelvic muscles lengthen. That pause is where the magic happens. Most men think lifting heavier is better. In this case, it's not. You're training circulation and nerve signaling, not ego. When done consistently, men often notice better morning erections and stronger response within weeks. Third, glute bridges to support erection stability. This one is huge, and it's almost always overlooked. The glutes play a direct role in pelvic stability and blood flow. Weak glutes mean your pelvis doesn't stay in an optimal position during arousal, which affects both nerve signaling and vascular flow. Glute bridges strengthen the backside of your body and reduce pressure on the lower back and pelvis. They also improve posture, which sounds unrelated, but posture affects blood flow and hormone signaling more than most people realize. When you perform a glute bridge, you're training the body to support an erection from the ground up. You're teaching the pelvis to stay stable while blood pressure increases in the area. The key here is slow movement and a strong squeeze at the top, without overarching your lower back. Most men rush this exercise, slow it down, hold the top position, breathe. What men usually think is that abs matter more for sex. In reality, glutes and pelvic stability matter far more. Fourth, diaphragmatic breathing to restore nerve control. Now let's talk about breathing, because this is where stress quietly destroys sexual function. Chronic stress keeps your nervous system stuck in fight or flight mode. That state directly suppresses erections. You can't have strong parasympathetic activation, which is required for erections, if you're constantly tense. Deep diaphragmatic breathing retrains the nervous system. It increases nitric oxide, improves circulation, and relaxes the pelvic floor so blood can flow freely. Here's the important part. This is not relaxation breathing. This is functional breathing that restores the nerve pathways involved in arousal. When you inhale deeply into your belly and exhale slowly, you're signaling safety to your body. That signal is necessary for sexual response. Many men notice improved sensitivity and easier erections simply by fixing how they breathe. Most men think they're breathing fine. They're not. Shallow chest breathing keeps the body locked in tension. Fix this, and everything else works better. Fifth, walking with intention. The forgotten exercise. This last one sounds almost too basic, but don't underestimate it. Walking done daily and intentionally is one of the most powerful ways to improve erectile health. Walking improves circulation, lowers insulin resistance, reduces cortisol, and supports testosterone balance. It also keeps blood vessels responsive, which is critical for erections. I'm not talking about a casual stroll while staring at your phone. I'm talking about brisk walking with posture, arm swing, and steady breathing. This keeps the vascular system elastic and responsive. Men often think cardio has to be intense to matter. It doesn't. Consistency beats intensity here. When men commit to daily walking, erectile reliability improves because the entire cardiovascular system improves. Sexual function is cardiovascular function. You can't separate the two. I worked with a 52-year-old patient. Let's call him Mike. Mike had a solid career, a long-term marriage, and he considered himself pretty healthy. He went to the gym a few times a week, lifted weights, and his labs were technically normal, but his erections were inconsistent. Sometimes they were fine, other times they were soft, delayed, or didn't last. That unpredictability was killing his confidence. What really stood out was how much mental energy this was taking from him. He was constantly worried about performance. He avoided initiating sex. He told me, "Doc, I still want it, but my body doesn't always show up." When I evaluated him, his testosterone wasn't the main issue. The bigger problems were poor pelvic coordination, tight hips, weak glutes, shallow breathing, and chronically elevated stress. In other words, his system wasn't working together. Instead of throwing medication at him right away, we focused on the basics you're learning here. Daily walking, deep squats with pauses, proper pelvic floor activation and relaxation, glute bridges, breathing work every day, especially at night. Within about 4 weeks, Mike noticed something important. His morning erections started coming back. That's always a great sign. By 8 to 10 weeks, his erections during sex were stronger and more reliable. But the biggest change wasn't just physical. His anxiety dropped. His confidence came back. He stopped overthinking every encounter. The first myth is that erectile issues are always a testosterone problem. This belief exists because testosterone gets all the attention, and yes, it matters, but it's only one piece of the puzzle. I see plenty of men with normal testosterone who still struggle, and others with lower levels who function just fine. Erections depend more on blood flow, nerve signaling, and muscular coordination than most men realize. When you focus only on testosterone, you ignore the mechanical side of the problem. The second myth is that pills fix the root cause. Medications can improve blood flow temporarily, but they don't retrain your muscles, your nerves, or your cardiovascular system. That's why many men notice diminishing results over time or need higher doses. The pill becomes a crutch instead of a solution. When you rebuild the system, medications, if needed at all, work better, not worse. The third myth is that if you exercise, you're covered. This one hurts a lot of egos. Lifting heavy weights or doing random workouts does not guarantee pelvic health. In fact, some gym routines make things worse by increasing tension and stress without restoring mobility or circulation. Sexual function requires specific movement patterns and nervous system balance, not just effort. Here's the truth most men aren't told. Erectile health is a reflection of how well your body coordinates blood flow, nerves, and muscle control under relaxed conditions. When you train that intentionally, results follow. When you chase shortcuts, frustration builds. First, strong erections are not just about desire or testosterone. They depend on blood flow, nerve signaling, muscle coordination, and stress control working together as a system. Second, pelvic floor activation matters, but only when it's done with control and full relaxation, not endless squeezing. Third, deep squats restore pelvic circulation, hip mobility, and hormonal signaling that men naturally lose with age and sitting. Fourth, strong glutes support pelvic stability and help maintain erection firmness, which is why exercises like glute bridges are so effective. Fifth, diaphragmatic breathing is not optional. It calms the nervous system and allows erections to happen naturally, instead of feeling forced. And finally, daily intentional walking keeps your cardiovascular system responsive, which directly supports erection quality and reliability. When you focus on these fundamentals, you're not chasing quick fixes, you're rebuilding function. If this video helped you see erectile health differently, do me a favor and hit the like button. It tells the algorithm to show this to more men who need it, but aren't hearing this anywhere else. Make sure you subscribe to the channel, because every week I break down men's health topics that actually matter after 40: hormones, energy, confidence, and sexual performance, without the fluff or scare tactics. I also want to hear from you. Drop a comment below and tell me which of these areas you think is your biggest challenge right now. Pelvic strength, stress, circulation, or consistency. I read those, and they help guide what I cover next. And if you're serious about improving your performance, check the description below. I've put a free men's health guide there that walks you through the fundamentals step by step. Grab it. It's a great place to start. Remember this: you're not alone and you're not broken. Your body is responding to the signals it's been given. Change the signals, and the results can change too. If you're a guy over 40 and you're ready to take control of your sexual health, here's what I want you to do right now. Hit that like button so other men struggling in silence can see this. Subscribe to the channel because I break down real, actionable men's health strategies every week that actually work for guys over 40. Next, drop a comment below and tell me which area do you struggle with most: pelvic strength, stamina, circulation, or confidence. I read every single comment, and your feedback helps me make content that actually helps you. And don't forget to check the description. I've put together a free men's health guide that walks you step by step through the exercises and strategies we talked about today. Grab it, follow it, and start seeing results. This is your chance to stop guessing and start taking action. Don't wait. Your body responds when you give it the right signals. You're not alone, and you're definitely not broken. Every man goes through changes, but the right strategies can restore function, confidence, and energy. I'm Dr. Rosalia Viterbo. Keep taking care of yourself, stay consistent with your health, and remember, small, smart actions today can make a huge difference tomorrow. Stay strong, stay healthy, and I'll see you in the next one.